brought it back, and then I said, "Ma'am, your results are great. You have no sleep out. You're not even close, right?" And she basically said, like, "I have a confession." He goes, "The reason I did the test was because I wanted to show my husband how easy it was, because he snores like a freight train."
Hello and welcome once again to another actual episode of Sun City SITREP. This is your host, David Barraza. Today we have a special guest, Dr. Tom Connor from Sweet Dreams. Dr. Connor, how are you doing today?
Oh, good. Thanks for having me, David. Appreciate it.
No, honestly, I think I'm very excited to actually have you out here. Dr. Connor, can you actually go ahead and explain to us a little bit what is Sweet Dreams?
So, Sweet Dreams is the dental approach of treating sleep apnea. There's multiple approaches, and it's what we do in our dental profession to help people with sleep apnea.
And I, as an individual, I have sleep apnea, and I'm also, an individual, a patient of yours in this. And I think that the product that you have is something amazing. Can we kind of go ahead and talk about, what is sleep apnea?
Um, Sleep apnea is basically when there's a cessation of breathing or enough where it drops your oxygen multiple times at night. So, your brain doesn't get the sufficient oxygen it craves, and then you have several side effects as a result of these, lack of oxygen to your brain.
Basically
Yeah.
going through. So let me ask you something. Doing the fact that, your primary, actual discipline is dentistry. Why did you get into wanting to help people fix their sleep?
It actually started a few years ago. I went to a conference in Las Vegas, and I just happened to take a dental sleep course. I wasn't familiar with it, but the speaker, she was saying how she could, like, transform lives, and the gratification she received from patients was like amazing, and it would tell stories of how she could, like, about people that died of sleep apnea and all that. So after the class, I mean, that just planted a seed. So fast forward many years later, um, my dad, he had sleep apnea. He actually passed from it. He had a major heart attack at age 60, but I,
Wow.
I didn't know about anything about sleep apnea. I just knew he snored really loud, and he would get, had blood pressure, would gain weight, and this, bad cycle of health like caught up to him. And then, when I dove into it, and I realized, wow, like, the sleep apnea was probably a major contributor to him passing at a young age. So that's what began my passion in diving into
That's
doing sleep apnea.
first and foremost, may your father rest in peace. That's honestly, that is an amazing story that, your passion for trying to go in there and affect people's quality of life through the sleep is something that I find to be, amazing. So can we kind of stay in that topic in regards to, well, you know, a person out there could be like, hey, my husband snores a lot, or my wife snores a lot, or my kids snore a lot. Now, is this actually something that, is hereditary? Are you born with this? Is this caused by something? Because, sleep is important. So,
Yes, it is very important. But the answer is yes to all above. So
really,
there is definitely a genetic component to sleep apnea, like a lot of things. People could have, developed a smaller jaw, and having a smaller upper jaw would, give you a higher incidence of sleep apnea. Or like on environmental, like if you're overweight and you're having fat, deposit in your tongue or your paropharyngia, your breathing area, then that can contribute to sleep apnea as well. And then other factors like even medications contribute, drinking. So it is a mix of both for sure.
so now let me ask you, the product that you actually go out there and that you have, it's right there sitting on the table. Um, this is way different than what the VA gave me, when they diagnosed me with sleep apnea. And honestly, as my personal account, and I'll give it freely, I jumped into this product because having sleep apnea and having those tubes all around you, I'm gonna be honest with you. Every time that I would put it on, as I would wake up, that thing was nowhere near me, or it was around my neck, or somewhere up here in my
Right.
forehead, or in the floor,
Hmm.
and it was just extremely uncomfortable. And the quality of life in itself was, you know, honestly, if I'm gonna be honest, I mean, for all of those out there, because I've met people that they swear by their machine,
Hmm.
but I've also met a lot of people that are like, man, I just can't do this. So can you talk to us a little bit about, why does that happen? I mean, in regards to the usage of a CPAP machine and how much better this product is, because I want to give my personal testimony on this as well.
Sure. I mean, not to throw any shade on a CPAP. It is a fantastic product. However, we're humans, so like people have a claustrophobic feeling of like straps on their
Yeah, yeah,
face.
that thing where it's,
Yeah.
you wake up
R-
and yeah.
Right. And then if you like move in your sleep, going side to side, you could break the seal. So, I mean, there is a statistic like up to like 50% of people cannot tolerate the CPAP
Wow.
up to for their first year. And that means we have up to about 50% of people who are still suffering from sleep apnea, in which like there's a product like I do with the oral appliance, and there's other things that can still benefit them, and that's where I jump in with the oral appliance. And what's nice about the oral appliance, it's pretty simple. It's just basically like a mouthpiece that keeps your mandible, your bottom jaw in a forward position, so it keeps your tongue out of the way, keeps your airway open. You can roll around in the bed. The maintenance is a lot easier, and people tend to use it with a lot more efficiency than the CPAP.
Look, not just because, to me as an individual, since I've been using this for the past, almost 2 going on 3 months, my quality of sleep has gotten way much better. I'm losing weight. I feel way younger. If I'm gonna be honest, I mean, it's helped me from all different types of, my wife is not that mad. I'm not snoring,
Yeah.
or not sleeping.
Hmm.
Is that some of the things that you kind of hear in regards to the usage of your product?
Oh yes. So like, I mean, we're meant to breathe. So like, this product helps you maximizes your breathing, put
Hmm.
your airway in an optimal position, so you maximize your breathing, and you're not getting cut off by your tongue or your jaw. Um, and when you breathe well, you feel great. I mean, if you don't get enough oxygen to your brain, you're having all kinds of issues, and it also can affect your spouse as well. If you're a loud snorer, then they don't sleep well, and lack of sleep is bad for your health. I mean, they even have people with graveyard shifts is considered a carcinogen because
Wow,
of the time when they're
worse
supposed
than
to sleep.
smoking cigarettes.
Yes. So, I mean, just even with sleep apnea, your chances of cancer are 50% higher because your body is not healing when it's supposed to. You're not getting, your growth hormones, all your hormones that are fixing you up at night. And it's a big issue. And some people think it's just about the sound, but it's way beyond that. Yeah.
Look, one of the craziness is that, the majority, even myself, before I began to really dig in and because I wanted to change, I was really tired. I was tired of feeling groggy. Like, and even that's with me. But first and foremost, like I said, I attempted to use a machine, for several years, and it just doesn't stay on. No matter how tight I put it on, I move a lot.
Hmm.
But the sensation of feeling groggy, cranky, all the time wanting to go in there, and there's this level of restlessness that happens. And of course, like any good individual, I succumb to food, comfort food, to try to go in there. So then you jump into this crazy vicious cycle. um but I guess people don't know what they don't know. So one of the things, what would be, backstage, you kind of described it this way. It's like having an actual, your airway closes because your jaw kind of drops. Having that stabilization kind of is like putting like a straw where you're able to go in there and have some type of airflow. Can you kind of explain that mechanism?
Oh, right. Yeah, exactly. So it's a great analogy. So in the breathing world, in our sleep world, like a little is a lot in the space we create for breathing. So imagine, a liquid being air,
Hmm.
and like those coffee stirring straws are very
Yes,
tiny.
yeah.
So imagine trying to drink through that sucking up the liquid is very labored and you can't get great volume, right?
Exactly.
Now go up to maybe like 2 millimeters more in diameter to like a fast food straw, right?
Mm-hmm.
And you know how fast those,
Oh,
you
most
drink it.
definitely.
Yeah. So imagine like, you're just creating a few millimeters of space in your airways. So that's night and day of how much oxygen you're able to intake naturally. See, with a CPAP, it's like forced air because there's a pressure that forces air, right?
Okay.
So like, but the beauty about the oral appliance is your own natural breathing. I mean, so you're just putting your jaw in a position is what you can do on your own. There's not a machine or
So
anything.
it's natural. It
Yes,
allow. Okay.
yes, exactly.
So now let me ask you, in regards to this, does this affect, predominantly males? Does it affect predominantly females? Can it affect children? I mean, who can really be affected by not sleeping properly?
All of the above.
Really?
So we can go in that.
Children could have it too?
Oh yes. So like, if you've seen kids, I mean, first of all, kids shouldn't really snore. If they snore, there is a breathing issue.
Okay.
And I mean, a lot of times it could be just the tonsils that add noise. Other times it could be just maybe they're born with a deviated septum or anything, and just a narrow airway in general. But when children have it, it manifests in signs like they can lash out. They'll have ADHD symptoms.
Really?
Yes.
So
So
is that due to the lack of sleep or not obtaining quality sleep or
yes, lack. I mean, not attaining quality sleep,
okay.
right? Like in oxygen, and not attaining quality is also probably a lack of sleep, right? You feel like you didn't have that long duration of that good deep sleep, right?
Mm,
So like with kids, they can put these ADHD kids in a room, and you can have all these doctors come in, and based on symptoms, you can't tell which kids have sleep apnea versus which ones have an actual chemical imbalance for ADHD.
really?
So there are a lot of kids that are out there that may be possibly medicated that really may not have ADHD, but simply sleep apnea. So you definitely have to rule it out prior to having your
Wow.
kids on medications.
You
Yeah.
see, and that's pretty because me as an individual, I don't sleep many hours, but since using your product, I've actually gone in there, and even if I'm getting 4 or 5 hours of sleep, but I feel rested. Like I really feel with energy. So I guess the importance of sleep is that, like you said, quality sleep is good. I can only imagine what a child is kind of feeling because, if he has never, is there a lot of people out there that potentially have sleep apnea that have not been diagnosed as well?
Probably most. Really,
Really?
yeah. I would say, I don't know, maybe go as high as third or more of the country. Maybe
The
like,
country.
I mean, I think so because like, let's say for children who have trouble with bedwetting, they're an older age and you
Hmm.
can't break their bedwetting, and sometimes it's not their fault. It's because they may have sleep apnea, like their body doesn't shut down completely to stop all those urgencies to use the restroom.
Oh, wow.
So like even though they're asleep, their body doesn't sleep deeply, like cut themselves out completely. So if they have to use the restroom, whatever, they just go as though they're awake. So
Wow.
like if you get into the deep sleep, you can stop those urgencies and not do the bedwetting. So, and then they can wake up with like these darknesses under their eyes, and they lash out more like I said, ADHD symptoms or focus or and like maybe struggling in school because of their sleep, and it's not necessarily for anything else.
Wow.
Yeah.
As you were describing that, I started imagining like the amount of children across the entire nation and maybe even the world that could potentially be having this. And they get into this crazy rut where it's like, hey, I'm not sleeping well. I'm tired. I'm always groggy. I don't know I have sleep apnea. But then I go to school. I'm not paying attention. I'm already demoralized. I get in trouble.
Right.
And then
Yeah.
it's this vicious cycle where it's like, now I gotta go home. I gotta deal with my parents, and then there's a lot of chaos going on. There's this cycle of viciousness where if the individual simply had good sleep, he could potentially go in there and be able to focus more.
Hmm.
Wow. So what would be one of the things that you would recommend parents, because maybe what if they're 7 years old? Could that be a potentiality?
Oh, absolutely. One is like if I would say all parents, if your child snores, then 100% definitely get them a sleep test because it could be just a simple fixes like maybe like tonsils adenoids, and like my youngest son in particular, like he was started snoring very loud, and he had enlarged tonsil adenoids, and he was suffering as well, getting the darkness under his eyes and just being groggy. Then we got his tonsils adenoids out, and night and day doesn't snore, wakes up fresh, feels good, and just because now his brain is getting the oxygen it needs, and he can develop to his potential.
That is so. Now let me ask you, because as your practice as a dentist, can you actually go out there and see if somebody has, like you had mentioned earlier, like maybe they have a smaller upper, jaw? Could this be something where, because I know you do this in your practice. Like if there's individuals that kind of confine this in you, this is where you step in, and this is why you're able to go in there and assist them. Um, is that something that can be detected through the dentistry portion, or because another thing that I kind of wanted to talk about was the fact that within your actual what the product that you have as well is that people don't need to necessarily go and take a sleep study. Like when I did my sleep study, I had to get connected. It was all
Mm-hmm.
over the
Right.
place,
Yeah.
and I thought that was kind of funny because number one, I just don't sleep well anywhere, if it's not my own bed. So, I kind of figured like, but even the home take test that they give you, it's just a bunch of wires. So
Right.
can you talk to us a little bit about that, to where, let's say that all of a sudden I'm a concerned mother, a concerned father, and I'm like, man, how do I know if somebody's actually going, my son is going to bed, or if I'm actually sleeping?
Mm-hmm.
Can you talk to us a little bit about, how your program works, how people can actually go in there and find out to see if they might have sleep apnea without having to go to, you know, and get all connected up?
Sure. Those are great questions, David. So my office, like as a routine for any new patient, or even any patient who's coming in for their 6 month exam, I always ask them first of all, like if they snore, or are they having morning grogginess, and I ask them about their sleep. So I verbally am screening them. And then as far as like you were saying, like how do parents know? Like I can, just been doing it for a little bit, so I can like see a child's face, and they have a different shaped face when you don't breathe well.
Really?
Yes, and then like their eyes, and then I use like CBCT, like that, which is cone beam technology radiograph, so I can look at their airway, and if I see like a constriction, or if I see enlarged tonsils, then I dive deeper into the questions, and I'll ask them about symptoms of focus, or if I look at their medications as well, if they're like on ADHD medications and for children, and then I'll ask like, well, how's your child's sleep? Because maybe it's related to sleep, not so much a chemical like imbalance with the children. So once we do that and identify, then, and you're right, like having a polysomnogram sleep test is very thorough. It has wires on you. You do
Mhm.
have to sleep in a foreign bed. However, with when you're diagnosing sleep apnea, it's important that you get the kind of sleep you're getting at home, right?
I
So,
would imagine, because that actually would be yeah, that's exactly my point, because that would be a better baseline test, because you're in your natural environment,
absolutely, yes, absolutely.
so how have how are you helping your patients to actually go in there and be able to obtain an actual sleep test, you know that kind of finds the patient or the potential client in their natural, kind of habitat or state. So what is it that your organization kind of does to
Right.
mitigate that?
So we do a take-home sleep test, and it's very simple. It has like 7 channels of reading, and basically it's like a rubber ring that you would put on your finger. So it's not invasive. You don't have all these wires strapped. You can sleep in your normal positions. You can roll around. So it's gonna record you in your normal natural sleep. Versus like, let's say you go to a sleep center. I've had this test done at a sleep center. You're put the wires from head to toe, and then you're really limited. You can't really turn left, or you
Move,
can't do a
yeah.
360 because the wires get tangled. And really, let's say you don't get a good night's sleep, or sleep at all. Yeah, I mean, your eyes may be closed, but you're not sleeping. Then you're gonna get like a false positive, as though you really don't have bad sleep apnea, because you got to get into the deeper sleeps to see how your breathing is. So,
Wow. So
yeah,
that's super crazy that you
yeah,
mentioned that. So a false positive could be, in other words, if I didn't truly go in there and hit, I think you said it was REM, my REM, correct? Is that what it
yeah.
is?
It's like like there's N3 and REM where the rest, but I mean, as far as like, have you ever been in bed where like your eyes are closed, but you're really up to thinking, so you're not really
Exactly.
asleep.
Yeah.
So like when you record, I mean, you're still you're very conscious of yourself, so you're on your own. You're not on your automatic breathing, if you will, like or your
Okay.
on the sleep. So like no one has sleep apnea when they're awake. How's that?
Makes
Yes.
sense.
Okay.
Okay.
So that's the
So in
simple
other
way.
words, that
Yes.
we go
Yes.
back to why the natural habitat is important because at there, maybe you're sleeping your 9 hours, maybe you're only sleeping 1 hours, but that's where you kind of actually hit that real
Right.
sleep. You're
Exactly.
not consciously awake.
Mm-hmm.
Wow. So then therefore your method is, and I guess your methodology is like, hey, let's test people in their natural actual habitat. Let's get an actual true reading. Because it's so crazy that you said that because I've met a lot of friends that they're like, well, I snore really bad. My wife is always complaining. I went to I went to, take a test and they told me that I'm fine.
That's a common story, and it's not true because the wife is proof. The wife will say, "I've seen you stop breathing. I've seen you like gasp for
Yeah, I
air."
have to kind of hit you to
Right,
like
but because they don't sleep in their natural environment, they don't get that same sleep, and
that blows
that
my
yeah.
mind. So
So
I see the
those poor patients are
methodology that you do.
untreated, and they're still
Yeah.
suffering. Right?
So
Yeah.
imagine that you actually had that person, whatever, Joe, whatever, who's
Hmm.
always so angry, and it could not mean that that guy's a crusty old person. It just might be that the guy's not sleeping,
Hmm.
not breathing correctly. So
Right.
therefore, so now let me ask you. So you're saying that can you describe us kind of the process once again? So basically, let's say they go in there, they contact you. Um, uh, what would be the process? Like if somebody like is listening to this and is like, hey guys, stop talking. Like talk to me about the process. Like what do I have to do? Like I'm suffering over here. I can't sleep. I want to change my life.
Right.
Like, what would be the process, like, for them to actually kind of go in there and contact you? And then I would like to go in there and kind of jump a little bit more and talk about, you know, a, a little bit more about sleep.
Okay. So I mean, our process is pretty simple. Like if
Okay.
you like snore or feel tired or you feel like you're not having a good sleep and you want to see how your sleep is, I mean, you would just come to our office, and we fill out a one-page form, and then you just download the app on your phone, and we let you take the ring, sleep with it. I get the data. I send it to a board-certified sleep doctor to get the diagnosis, and based on that diagnosis, we give you your options to treat your sleep apnea.
Really?
Yes. And let's say that you come out negative for sleep, which is, I mean, it can happen, but then we know that there's a good chance whatever you're having, the issues is not sleep related, then I would say, okay, well, now go to your primary care and say you had a sleep test. So, but we're not leaving someone there like unattended, like we're going to put them in the right direction if it's something we can't do,
Wow.
or if it's something we can do, we're going to do it at our
Yeah,
office. Yeah,
refer them
right.
out because like
Yes.
you said, it might not be that it'd be a sleep issue. It could be something, I don't know, within the body, that the
Mm-hmm.
person's having. So what you're saying is that your actual method is like no matter what, whether you need this or you don't, we want to set you up in the right way because we want to better
Absolutely.
your quality of life.
Right.
I love that. I
Yeah.
truly love that model, and I think that just the simple story behind it, like you're saying. So I kind of want to talk a little bit more about sleep, and I do apologize that I'm getting a little bit personal, but I kind of want to go in there and one of the things that I was telling you earlier, and without mentioning any names, was like, hey, I've heard that these machines that actually push these CPAP machines, they're not that hygienic. And there is some issues that they've been having. Can you kind of, discuss a little bit? Because you're saying they kind of force air.
Oh,
So yeah,
yeah, I know
yeah,
what you're referring to.
yeah.
So, not to mention it, but there was a company that's been on the news and stuff where the filter of the CPAPs would get into the system and cause lung
Oh
issues.
wow.
And then, I mean, literally, it was a big class action lawsuit. Where like over 1,000 people pass from the
Wow.
CPAP. But let's say outside of that, let's say
Yeah.
typically your CPAP's working well and all that. there's a maintenance factor, right?
Maintenance factor. What do you mean by that?
So like you typically, you have to get a distilled water. You got to have
Yeah.
electricity. So, if you travel, you got different voltages, different outlets.
Oh
You got to
yeah,
do
tell me.
that, and then you don't
I
want to
know
be stuck, right?
exactly.
And
Takes
then,
so much space in your bag, by the way.
right, yeah, exactly. And then with the hoses, you got to make sure they're clean because they are running a little bit of water for the humidity. So if you don't wash the hoses on a routine basis, you're going to build like bacteria and fungus, and that could be dangerous going into
Wow.
your lungs, right? Yeah,
Yeah, that is just what, you know
right.
what? I was not thinking, because look, in order to clean it, I had to buy this huge, I think it was like a 2 feet by maybe, 2 by 2 huge, plastic bin where I had to put distilled water,
Yeah.
had to make sure that I run it through. I had to use a specific little soap that they gave. It was like, and then I had to hang everything up. I
Right,
mean,
yeah.
I'm talking about, it was at least minimum 1 hour to make sure that everything got correctly. But I've always thought about that because most hoses, they're not, it's not a perfect cylinder. They have small little rivets. So I've always thought like, well, how do I clean those little
Right.
rivets? You know what I'm saying? Because I would imagine that it's like anything. If you leave a little bit of moisture in there, I'm pretty sure that around those little rivets, those circles that kind of make the entire
Oh,
hose, that you're gonna
definitely.
get like some type of mold or something
Definitely
like that.
susceptible to that, right? So,
Wow.
so and then there's the maintenance. That's why you have to change your hoses and masks every 3 months with the sleep
Yeah, no,
doctor, right?
correct. But
Yeah.
imagine how if everybody does it, and you're saying, I don't know how many people here in El Paso have sleep app, and if everybody was faithful in cleaning their tubes, that means that that much is going to the landfill, that much is getting thrown out, that much is that much waste is happening.
Right.
I mean,
Uh-huh.
that's pretty crazy. Now that the way that you're painting it, that's a pretty crazy concept.
Right.
So it's a lot of waste.
Yeah, it definitely can be. And like I said, like I don't know, I like the philosophy of your body being as natural as possible, And
Wow.
so
Okay.
so like, when you think like the oral appliance or maybe something like even like weight loss, nutrition, I feel like that should be your first line of defense. And then if that doesn't work, then you go into the mechanical stuff, right? So like
Mm.
with the like an oral appliance, wouldn't it be so much nicer to you're breathing not on your own, versus
Yeah.
like
Exactly.
a forced air coming into you to prevent like your tongue from collapsing and all that. Like,
Oh.
and absolutely, there's a great place for. See, it works great. I'm not here to badmouth it. It works great, but like I would say, like me personally, I'd rather do it on my own than machine if I could.
Yeah, plus who
Yes.
wants to be looking like Darth Vader and then
Yeah.
talking to your wife and
Right.
being like, "Hey, honey,"
You're right.
you're just kind of breathing in and out. I mean, yeah, it's because that's the one I use, the full phase. Of course, there's people that use the ones with the nostrils. I mean, everybody their own. But the more that you're talking about this, I mean, with the actual oral appliance, and let me just kind of go in there and pick it up, and maybe the camera could go in there and kind of see what we're talking about. It's just basically this.
Right. Yeah.
It's just
Pretty simple.
basically a simple. Basically, and that's
It,
what it's doing. It's just pushing the actual jaw
yeah.
bag.
So basically, like on the side profile, it's like putting your jaw a little forward to maximize your airway, getting your tongue out of the way.
And it's snug.
Yeah,
It fits snug. It doesn't fall off.
and it like also helps with like it's a 2-in-1 because you're probably grinding if you have sleep apnea is a high
Oh,
incidence,
that's
so
true.
that will help your grinding and your airway all
At
in
the
one.
same time.
Yes.
And then this basically is the actual
Yes.
ring, correct?
Yes,
So
it is.
basically, it just goes in your finger.
That's it. You can. It's pretty comfortable. You get to sleep, and then, I mean, it's nice too because there are instances where you do want to go in the lab sleep study, but that will screen it. Like that's called central sleep apnea, where your sleep apnea is caused by your brain. So that will say if you have central, yep, and then you say, okay, you go to the sleep doctor, get the wires and all that because you need to. But for the majority of patients, probably 90-something% is obstructive sleep apnea, and that does a great job. Had to check it.
Wow.
Yeah.
So, and like you said, your process is very simple. Just simply either go out. So, if people want to contact you, what's the actual phone number that they have to go in there where they could call you and say, hey, you know what? If you want more information.
Oh yeah, I made it simple. It's 915-33-SLEEP or 915-337-5337. But if you
Okay.
just remember 33-SLEEP,
3 3
you get a
sleep, and
whole
then you'd
yeah.
be able to. I like
Yes.
that. It has a little ring to it. So back to actually going in there and going on sleep. Um, what are some of the things that you would let individuals out there in regards to sleep hygiene? So let's say that they're like, hey, well, is there anything that we could, go out there and begin to do? Any steps, any recommendations that you would have for individuals, as we were talking a little bit on backstage, like that you would like to go out there and kind of let them know, like, hey, this is important to kind of go in there and know. That way, maybe they're not, they don't know whether they need this or not, but so that they could kind of start. What pointers would you give them?
That's a great question because I mean, I like the fact that you know that sleep is attacked from many angles, right? Like,
Yeah.
like people, I mean, people just want to think like an oral appliance or CPAP or, and that's it. But there's things that you can do that can even give you a better quality of sleep when you're using this as this is a tool to improve your
Let's kind of
breathing.
talk about that.
Yes.
Yeah.
So like you're seeing like sleep hygiene. So, like people who are trying to get good sleep, and one of the big things we have today is screen time, blue light, right?
Blue light, the
Yeah. So
phone.
yes, the
And when
phone.
we're wearing on
Yes,
Instagram,
yes,
which
yeah.
by the way, what's your Instagram handle? Just in case people want to go out there and they want to follow you or they want to see some of
Oh
it.
yeah, absolutely. Yeah, it's sweet dreams at sweet dreams underscore breathing underscore wellness.
There we go.
Yeah.
Okay, sweet. So blue light that goes
Yes.
in there and they kind of.
Yeah, yeah. So like it keeps your mind active, so you're not shutting off. You don't get that good sleep. I mean, and then you want to avoid like this. I think a lot of it's some of it's common sense. Like you don't want to take a stimulant when you go to bed. Like
So you're like a Red Bull or
caffeine, Red Bull.
caffeine.
Yes, exactly. I mean, but another stimulant is like some people would not think of is like exercise too. Like so, exercising late in the evening before bed, so for some people keeps them like energized, like as though they had an energy drink, and that
Yeah.
would be more ideal for those people to work out in the mornings or earlier in the day, or if you're gonna have caffeine, have it before noon. Um, just in our screen time or TV, like cut off 1 hour before you go to bed and create that atmosphere. So like one of the biggest
Okay.
stimulants of good sleep too is like we was built into us is like with when you see light and darkness. So we have bright lights around us, all that. It's we
Yeah.
naturally want to not go to sleep. So
Really?
yeah.
What is that? Does it kind of affect your overall inner clock, or is it just stimulation of the light that
Yes.
doesn't?
So yeah,
Okay.
absolutely. So it does. We have like our there's the hormones like melatonin and stuff. So
Hmm.
like, but in the sleep world, like you have you have your circadian rhythm
Okay.
and all that. So like, and one of the biggest it is like light and darkness. So that's why like we went to the point of like the nighttime workers. When it's all dark outside and they're working, then you can sort of mess up your rhythm of sleep. Yeah.
And you mentioned that, and let's kind of stay in there because you went in there and you said, hey, you know what, like. Because, look, a lot of individuals, a lot of my actual, good fellow individuals, and shout out, to all those people, policemen, civil servants, a lot of these individuals, people that work, in the ER,
Mm-hmm.
nurses, doctors, a lot of these individuals that are, in other words, they're pulling the all-nighter.
Yeah.
That's what you're kind of referring to. That kind of goes in there and that kind of affects your inner clock or your inner
Right.
compass, correct? So, and you called it was the circadian
Rhythm. Yeah.
rhythm, a
Rhythm. Hmm.
circadian
Yeah.
rhythm. So now let me ask you, if those individuals, let's say you have that, you're already sleeping outside the regular hours, and then you have sleep apnea. I mean, is that just compounding the issue? Is that why people say, hey, man, if you work like that night shift, you kind of tend to look older after, 1 year working there, do you think that a device like, what you have, which by the way, it's the product that you call, it's called Panthera?
Oh, it's an oral appliance. The company I use is Panthera. I personally like it because it's made of nylon,
Okay.
and they're usually either made of nylon or some kind of acrylic.
Mm-hmm.
And nylon definitely has a lot less chances of someone being allergic to it,
Oh, wow. Okay.
right? And acrylic is a lot thicker. Like on those appliances, we're talking like they can be within a millimeter, less than half a millimeter of
Yeah.
thickness. And acrylic's probably going to have to be like a minimum of 1 millimeter thickness. So when you add all that, the bulk in your mouth of an acrylic appliance is going to be a lot greater than the nylon. So I use the nylon because it's durable. You could throw it against a wall; it's not going to break. It does its job. And in the bulkiness, right?
Honestly, I could attest to that because the one that the VA gave me is so much thicker. It really doesn't feel
Mm-hmm.
comfortable in my mouth, So then when we finally went in there and I continued to do research and I found out about what you were doing and jumped on, it's night and day. I mean, people, you might think like, oh, it's just, like you said, what millimeters in difference or whatever it is, but inside your mouth, like, sometimes I even forget when I wake up in the morning, I forget that I have it and I'm about to jump in and brush my teeth. And I'm like, oh Lord, I have to pull it out
Yeah.
and then brush my teeth. So the thinness of the product that you have
Yeah.
is something amazing as well, because there is the VA offers those. I mean,
Mm.
I'm going to be honest, the VA offers those, but it's just completely different in the size. So
Yeah. So like, yeah, there's definitely the bulk, but also it's like one material. So these are 3D printed, right? So you
which,
could
yeah.
literally throw that appliance against the wall as hard as you can, and it's not going to break. You throw an oral appliance or drop it with the acrylic with the metal side hinges on it, or it's going to break. Yeah,
And then you
yeah,
got to go back. And then the
yeah.
craziness, and let's kind of talk about that, And I know that I'm jumping out because I'm telling you, it's
Hmm.
helped me lose a lot of weight. And
That's great.
honestly, I
Yeah.
haven't been doing much difference. It's just I'm sleeping better. I'm sleeping better. My wife is sleeping better. The kids are sleeping better. Everybody's just much better because that gets to sleep. But my question to you is, the difference in the way that they do it in the VA compared to you do it. Can you kind of talk about that? Because I was very amazed when I went to your office and you're like, hey, let's go ahead and let's set you up. Let's do this. I figured that, we were going to go out there and do the whole, let me buy things and,
Oh, okay. Yeah, yeah.
but that's not the case with your product. So what makes your product so different? And I think this is pretty cool,
Well,
because it was
like,
so easy.
well, the process we do, like, I mean, what you're probably referring to is you probably had to take impressions of the impression material,
Yeah.
which is like the goopy stuff that goes down your throat and people don't like it, makes them gag and stuff, right?
Yeah.
And then from there, they have to send it to the company, pour it in stone, make the appliance. So
It's a whole,
the time you get your product back, it's taken a bit of time. And in the
yes.
meantime, you're suffering from sleep apnea, right? So my office, we like to do like the digital scans. It's a lot more accurate. You just basically get this wand and you go over your teeth. There's no shots. There's no gooey stuff. There's no drilling, and a whole scan of a whole mouth will take less than 10 minutes. And
That's
then,
wow. Yeah, I know. It really did.
right?
And
Yeah,
honestly, it literally looks like like my electric toothbrush.
yeah, yeah,
That's
exactly.
literally what it looks like.
Right.
And
Uh huh.
I mean, I remember just sitting there and that's so crazy how technology is nowadays. You just
Right.
basically took a whole imprint on my mouth with a little, I mean, I call it a toothbrush,
Yes,
electric
exactly.
toothbrush. That's what it
Essentially,
was.
right?
And it was done with an actual, I guess it was minutes that it was
Mm-hmm.
done. And is that more accurate than the
Oh,
actual,
oh, definitely. It's
and
my
why is that?
I mean, you think with impression material, I mean, everything is technique sensitive, right?
Okay.
But with impression material, you have this gooey stuff, right? And let's say that you did a great job with that. But now there's another step. Now you got to pour it with a stone. So make sure the stone doesn't have any bubbles in it. So there's a second step.
Okay.
And then on your stone, then they make the oral appliance, right?
Okay.
So
Okay.
I mean, just because you add more steps, you're gonna lose a little bit of accuracy, right?
Okay. So the potential of deficiency increases because it's
Yes.
so with this one you just scan it.
You scan it, STL send it to the company. So before you leave the chair, they're already processing your oral
That's
appliance
wild.
and printing it on the 3D printer, and that's why you get it within a couple weeks.
So that was basically because I still
Yeah,
remember you guys
yeah.
went in there, clicked the button, and hey, you're done. And I was like, Is that it?"
Mm-hmm.
And they're like, "Yeah." And it was less. I forget. I mean, we received it quickly within days. It was just we received
Right.
the appliance. I guess it took me longer to go back to your office to go in there and get it, but that was quick. That's so. I guess that's the win-win for the actual client to be
Right.
able to go out there and say, "Hey, it's just that quick and that fast and that easy." Now, let me ask you: Is in because it could be a question that everybody goes in there and has. Is that going to break people's pocket?
No, not at my office. I
Exactly.
mean, like from like just to throw out numbers, like most dentists typically going to charge somewhere between $3,000 and $4,000 for an oral appliance, right?
You weren't even you weren't even close that. So I mean,
Yeah, I'm about half of that 3,000.
yeah.
So and my It includes like all the visits to adjust it up to the 1 year follow up, the
Wow.
pictures, and the sleep tests with the appliance. That's all included in my package because I want, like I said, from my dad passing at a young age, that's become my passion. So
Exactly.
if I can help someone to get another decade with their family member or anything, I mean, I really enjoy this. Yeah.
And honestly, you just said there's something super, super because, when I was actually talking to you and you actually drove that, I was just because I thought to myself, specifically on that statistic that individuals that do tend to go in there and have sleep apnea or sleep issues, they tend to go in there and cut their life short, not, because of the implications of not sleeping, because of the taxing, like you had said, the taxing that your mind, your body, your organs take
Oh yeah.
in regards to actually, because it truly is, like, and you had kind of mentioned it, is like, is it truly somebody, do people really go in there and die of sleep apnea? Well, of course, the coroner is not going to say that,
Hmm.
but he will go in there and say, hey, there was, stress to the heart.
Right.
Hey, you know
Yes.
what? These other organs were affected. So my question to you, and this is why the number one reason why I jumped with you was because the passion that you have to help others. And honestly, one of the things, if I'm talking to the audience, if hopefully we do a good job in actually going out there and capturing that, because you took your personal story and you said, hey, you know what? That's enough. Like there's something potential that we could go out there and do that has a mitigation to the risk and it's a lot more safe, than other appliances. So I really want to thank you for going out there and doing that. Can I ask you just one question?
Sure.
What is the most common question that you get from the clients that come to you? What is a few of the questions that you tend to get a lot?
I mean, uh, I guess at first it's a surprise because I'm a dentist, and they're like, "Why is this dentist asking me about sleep?" It's more
Yeah,
about
yeah,
what I ask
yeah.
them than what they
Okay,
ask me.
okay.
So in my operatories, I'll have like a picture of the sleep ring and sleep apnea like appliances, and they'll look at the screen and say, "What is that? Like, what is the ring?" And I was like, "It's for sleep." And they're like, "Okay, but you're a dentist, so why do you? What is that?" And then like after I show them like the cone beam X-rays, show them the throat and how dentists are highly tied to breathing because it's the anatomy and that's our expertise.
Yes.
So and then we educate them and explain. They go, "Oh, I get it." Because I mean, it is funny because like a lot of times I'll ask them the question like, "Do you snore?" And they're like, "Yes." And I feel groggy. I go, "Well, let's get you a sleep test and see how you're doing." And they'll like, uh, "Well, I'll go ahead and ask my primary care first, but
Oh, it's
I'm trained in sleep apnea." I mean, like I'd probably feel the same way, but like
yeah.
prior to me being certified with this, like I had no idea about the stuff. I mean, you have to be educated. So I even see a lot of physicians around that really haven't talked about sleep apnea to their patients and stuff. And I'm glad that right now people are getting more knowledge of it out
Yeah,
there.
you're
Yeah,
because you
yeah,
were mentioning
yeah,
too, like I guess your Apple Watch now kind of
yeah,
has it.
yeah,
There's a
exactly.
lot of
Yeah,
other
yeah.
applications, and I guess do you think it's a paradigm shift to where we're beginning to realize, like, hey guys, like if we're not getting our sleep, our adequate sleep, or or just quality sleep overall, maybe this is where a lot of the issues are kind of happening. Is that what we're seeing, that paradigm shift for people
I,
becoming more
yeah,
un-
I think people are becoming more aware of it, maybe because of like social media and access to
yeah.
information. But like I see now, like patients will say like, "Oh, my spouse snores." I even had the funny story.
Yeah, please.
I had a spouse came in and she wanted a sleep test and then but she didn't fit the profile of someone who really has sleep apnea. She was
Really? What do you mean? She
lean,
was lean,
she was
fit?
lean, her face shape was good, her mouth and everything. But she wanted I go, "Sure, I'll give you one." And so she took the sleep test, brought it back, and then I said, "Ma'am, your results are great. You have no sleep apnea. You're not even close,
Re-
right?" And she basically said like, "I have a confession." He goes, "The reason I did the test was because I wanted to show my husband how easy it was because he snores like a freight train. So like she came in to take the test and she was like, oh, look how easy. And even though now she had leverage on her husband to make him do it to show him how easy it was, so he would go in.
You
And
see,
that was her sole reason of doing the test.
so wives, mothers, you guys heard it out here. That's a great way to do it, just because it's super simple.
Right,
I mean, you
yes.
just put it in your finger and then you
Right.
just sleep.
And like, yeah, so the husband didn't want me to bother, but then when she did it, and
Did he end up
it's
coming?
good. Yes, yes.
So I mean, but you know what? That actually highlights a huge thing, that there's a lot of people out there that are probably banging their head against the wall. They're banging it. They don't understand what's going on, and it's like you said, they don't know what they don't know.
Right.
So individuals that don't know, they're thinking, hey, you know what? I'm just not good enough. I'm always having trouble at work. Everybody thinks that I'm just this angry person. I'm not sleeping well. So it's that vicious cycle that a lot of
Yes.
people kind of
Right.
fall themselves in. And how do they say, like, I'm fat and I eat and I'm depressed because I'm fat. It's just this crazy
Right.
little cycle. So therefore, you as an individual, and would you recommend for people just to go out there and actually just take a sleep test just so that they kind of know? Would it be unaffordable to go to you and be like, hey, let me just simply go in there, take a sleep test, and then see what it is? I mean, is it can they just, let's say they just want to find information and they just want to get a sleep test. Can they do that through you?
Absolutely, like that lady did. But like, I would say, like, if you, let's say you're on diabetic medications
Okay.
or hypertension, blood pressure medications, and you have multiple medications in each category. Say you have anxiety, depression, weight gain issues, low testosterone, or you're having Alzheimer's, dementia, snore. I mean, any of those things, and you're on multiple medications, I would get a sleep test because like you not getting good sleep can help your situation versus you not getting sleep would make those situations worse.
Wow.
And there's a big thing like even with chronic pain.
Chronic pain.
So
Okay.
like it's like the question is like the chicken or the egg. Does the pain cause lack of sleep, or does the bad sleep cause the pain? So it's been
Wow.
studied that bad sleep gives people a chronic pain.
Really?
So when people with like chronic pain, all that PTSD, 100% you need to get screens for sleep apnea. I mean, it's just goes all over your overall health for different aspects if you have any of those issues. But like in this lady's case, like I don't snore, she's lean, whatever, no meds, like not so much, I mean, I guess if you're curious, you could, but if you have any of those other things, I would definitely get a screen. Oh, and my office, I mean, it's very affordable. You see the ring right there. It's like, this is a little over $100, and you can get a sleep test. The sleep center is going to cost you probably over 1,000 just to get screened, and you'll have that. You can be like have that assurance that if you came out good, like, oh yeah, I'm feeling great, or now you discovered something that you can start working on to prevent a lot of future health issues.
Future health.
Yeah,
And
yeah.
honestly, I think that that's super amazing that you said, for, less than $200, you're basically going in there and you're getting a sleep test that they could go to you and actually go out there and get that information. So now let me go in there. And one of the cool things that I think about this is this. So when I was in the military, I was diagnosed with sleep apnea. And we're going to focus now on the military side.
Okay.
Okay. So one of the craziness is that, so for instance, if the moment that I went in there and I got my CPAP machine, based on my actual MOS, there were certain things that I was not able to go out there and do. In other words, my mission readiness went in there and I was not able to go out there because if I'm going to go to an austere place and I need a CPAP in order to be okay, well, they're not going to be able to send me there because there might be no electricity. There might be nowhere to connect. I mean, it's kind of hard to, walk in the middle of a place
Right,
and be
yeah.
like, yeah, by
Yeah.
the way, guys, I
Yeah.
need electricity because then if not, but your appliance, that's something that many individuals on the active duty side could go in there and actually use, will still ensure that they're actually able to sleep. The size of it, the weight of it, is a no-brainer.
Oh yeah, because
I mean,
like
I just really literally thought about that right now because I was thinking, man, back when I was actually, in the military, that could be something that I could have used, would have kept me mission ready. I would have gotten the sleep, adequate sleep that I have. I don't need to go in there and have connections to where everybody's tripping around the small place that I might be.
right. And
I
I,
mean, has that? I mean, have you ever thought about actually going out there and saying this could be a potential use?
I mean, it's funny you say that because I do see a lot of active duty military
Okay,
patients as
you
well.
do.
And then what you're referring to is like going to the field,
Yeah,
right?
yeah, like
Yes, yes.
exactly, exactly.
Okay, you're right,
Honestly, and it's
right.
whether I was going to the field or doing
Uh-huh,
mission.
uh-huh.
It's very true, and it affects your readiness. So if you're somebody that wants to be the next sergeant major of the army and you want to stay there, you want to make sure that you stay lean and mean and and fit to be able to accomplish the mission. So you do see a lot of actual service members.
So correct me if I'm wrong. I mean, you're a former
Correct.
military. Thank
Okay.
you for your service, by the
Ah,
way.
I
Yeah.
appreciate you, brother.
But like the more you're able to go with your team, like in the field or getting deployed, I imagine it helps promotion time as well,
Oh,
right?
most
On your
definitely.
resume,
Look,
right?
honestly, yeah. That
Right.
so just you asked a question. So readiness, it's called basically your physical readiness.
Mm-hmm.
So during your physical readiness, they call it pulleys. That you have a certain aspect where you need to ensure that you are ready and you're on once. Completely ready to go. That you have nothing physical, nothing in your eyesight, nothing in mental. That you're 100% correct. Well, a sleep apnea, one of the biggest things that I had out there was, yeah, they went in there, they gave me the actual sleep machine. When it came time to going to the field and deployments, that's where you were affected the worst.
Right.
Do you see what I'm saying? And I believe that if service members would know about this product, knowing like, hey, I could go out there, I could get my diagnosis for sleep, I could use that if I ever decide to get out, but I want to stay. Hey, this product would allow my readiness to be there because that's literally what I'm thinking about. I mean, I could literally, when I'm wearing whatever my pajamas, I sometimes, put them in my
Mm-hmm.
pocket, or whatever, and you're able. It's so tiny.
Right.
So the practicality of using that is, I'm sorry, I get a little bit excited because I'm thinking about how many service members could potentially use that,
Right.
to better their readiness, to ensure that they're getting that good sleep. I mean, and it's just so quick. And you're able to. What's the actual lifespan of that? How long? Every when do you have to? I've never asked you this, by the way. Every
I
when do
mean,
you?
sorry. You're gonna finish your
Yeah. So
question?
sorry. So every when do I have to? Would you replace that?
Well, I mean, I believe on the insurance clause, it's you can replace them every 3 years. However,
Wow, that's still a long time.
I don't see. I haven't had one that has broken or anything. I mean,
Well, because of course it's the maintenance. I mean,
right,
if you, I put them in. It comes
right,
with a
yeah,
little can, and you can
yeah.
put like
Mm-hmm.
that what they use for dentures or whatever. There's some little cleaner that you go in there and you put. It looks like mouthwash.
Mm-hmm.
You just put it there, and you rinse that off every single often, and it works great.
Mm-hmm. I mean, I haven't. I've had to replace only because a pet got a hold of one, but never for any wear and tear issues or anything like that. And like I said, I've been doing this a few years, and it's only been either they lost it, like they left it in a hotel room, or a dog got a hold of it, and that's the
Okay.
only reason I've had to replace them. But what's nice is like since I do the digital scan, they're already in the system. I just send it out immediately. They don't have to come in again their next visit picking up
Wow.
versus doing
I
the
see
gooey
what you're
stuff
saying. So
again.
once it's in
Yeah,
the system, as long as
right.
these individuals had not had any major dental work,
Exactly.
it should
Yep.
be, yeah. Because like
Yep.
all of a sudden, if you lost all your front teeth, well, maybe
Yeah,
you
if
need to
your
get
teeth
rescanned.
change. Yeah, yeah, exactly, exactly. Yeah.
Because you went in there and you got, what are they called, veneers or something like that,
Mm-hmm.
whatever it is,
Right.
that would require a rescan, correct? Because
Right.
there's a
Oh
change.
yes.
Okay.
If you manipulate like your teeth shape have changed or whatever, then yeah, you need a new scan. But I mean, typically not. You're good.
Exactly. No, honestly, I am very excited. So once again, if there was anything that you would like to go out there and kind of, let the audience know, what would be something that you would like to directly kind of speak to the camera and let the audience know, like, hey guys, sleep is important, what would you like to let them know in regards to that entire notion, like that gentleman that you said? Because everybody's afraid. Like if you hear sleep study, everybody's gonna be like, "Man, I'm gonna get plugged up in wires."
Right.
So nobody wants to do that.
Mm-hmm.
I don't want to go sleep at another place. I like going in there and sleeping in my own bed. What would you tell people, that have an inclination and would want to go in there and say, "Hey, you know what? I want to change my life, man. I want to sleep. I'm kind of tired. I've tried everything. Help me, Dr. Connor." Like, what would your recommendation be?
Okay. Well, I'm going to answer that. I'm going to get back to
Yeah.
the military thing real quickly.
Okay, most definitely.
So with the military, like if you get a CPAP, it's just a rental basis. You never own it.
That's true. That
Yes.
is very actually true.
Whereas the appliance is yours for you get in, you stay in the military, get out of the military, yours forever.
Okay,
You're good.
wow.
Okay. But now back to your
Oh, wow.
question.
Okay, that
Yes.
yeah. You know what?
Yes.
That's actually very true. Yeah. Wow.
They can take
It's
it away from you, the CPAP, if you don't use it enough, whatever. Yeah,
you know
yeah,
what,
yeah.
and it's so crazy that you actually went in there and you mentioned that, and I know that, and let's kind of stay here because I love this topic. A lot of people don't know, specifically in the VA, if you're a veteran or you're a service member, all of those machines actually have a small SD card chip or an actual technology that's embedded with them. So if you think that just obtaining a machine, I'm not gonna use it, that people won't find out, that's actually not true.
Oh, yeah, I know.
And that's
Yeah,
that's
yeah.
very, very crazy, specifically for those individuals. They'll know if you're using it or not, because all they have to do is request the machine back. That little small thing has that recording, and it'll tell them how many times it's used and how many times it wasn't used.
Right.
So that's important. So everybody out there, that's something that you guys need to go out there and know that, that's tracked. Now, of course, I'm not suggesting that people are using it for nefarious things, but it's kind of to the point where, if number one, like you said, a lot of people don't use it because it takes up to a year, you said, right, for people to get used to. But with an appliance like this, this is literally what I do: floss, brush, rinse. This goes in my mouth, and I hit the rack.
Yeah, it's that simple.
I mean,
It's
literally,
that simple.
that's literally all I
Yeah.
have to do. I wake up in the morning, I put it out, put it on its little base, make sure that it's washed. Once again, floss, brush my teeth, and then I go about my day.
Yes.
So I don't have to mess with because it's so funny, and having that Dark Vader kind of look and waking up in the
Right.
morning, with all these marks, all of that is gone. It truly is, and honestly, it's. I mean, I really, if I could go in there and get my wife, she'll tell you, like, man, he is not snoring, I'm sleeping. So the quality of life just
So you're both happy.
Yes. Which,
Yeah.
a lot of individuals, have a lot of issues with their spouses because they're both probably not getting sleep.
I've
I mean,
seen
is that a true statement?
I've seen a lot of spouses that sleep in separate bedrooms because of snoring.
Wow. So if you're out
It's
there
a
and
pretty
that
common
person's
story. Yeah.
snoring so loud that even the neighbors, two houses down, kind of hear it. I mean, yeah.
Yeah.
Why wouldn't you want to change that? What do you think is the the hesitation of people not doing that?
I think one is probably convenience, right? So like you're thinking like, oh,
Okay.
I don't want to get the sleep test with all these wires strapped. It's going to be
Yeah.
super expensive, and and I have to take a day off work, spend the night in another facility. I mean, but now, I mean, with technology, that's no longer.
We're
You
in
can be in
2025,
your own
baby, right?
home, and for the price to fill up your car or whatever, you can get a sleep test and get your read by the same sleep doctor that you went to the sleep center for, and get your diagnosis, and then you start your treatment process, and then now, I mean, you guys can be in the same bed.
You see,
Right?
and honestly, if you go in there and you put an actual price point to this, I think I'd be willing to go in there and pay 3, 4 times over what you're offering right now, because, like you said, number one, quality of life improves.
Right, absolutely.
Longevity. In other words, you literally you extend your actual, because I think what was it backstage that you had mentioned, like the lack of sleep actually cuts down years. I mean, there's some type of study behind this.
Yeah, so like the the study is like if you have severe sleep apnea, I mean, there's a good chance that you're going to have a major incident, heart attack, stroke, death within the next 20 years, like a pretty high chance.
That is wow. So let's go in there and let's kind of think about this, because this is something that I want the audience to kind of. You're getting a heart attack from not sleeping and snoring. So can you kind of explain what's happening inside the actual body on why the lack of sleep would cause this?
Well, I mean, with sleep apnea, it's not so much the lack of sleep, but the way you're breathing while you sleep. So basically, when we sleep, typically our blood pressure is like 20 points lower. You're supposed to feel rest. Your heart's supposed to go slow down. You're supposed to everything is supposed to be calm, right? But imagine like right now, if you were to hold your breath 30 seconds and then you let go, your heart starts pounding, right? Because
Correct.
it's trying to get
Yeah.
the oxygen to go. And so like, so people with sleep apnea, there, imagine them holding many episodes of holding their breath. Their heart actually pounds, so your blood pressure is actually higher than what
Wow.
it would normally when you sleep. So
So it's
you only
causing
get
that
so
undue
many.
stress to your heart.
Yeah, so like, and this is a common thing with what's called AFib. So like your
Mm.
heart is working, because you're holding your breath, it's trying to get the, oxygen circulating in the blood. And so like when your heart's supposed to be resting, you're actually working more overtime. So you only get so many beats and stuff. And like any other body part, you eventually
So
give
that
out. Yeah.
undue stress on it. You
Yeah.
know, another thing that you were mentioning in backstage, and I don't know if this is inappropriate. You were mentioning something about the intubation in COVID and something about the overall lack of oxygen. Can you kind
Oh
of
yeah,
can
yes,
you kind of
yes.
explain a little bit about, because when you said that, it blew my mind. I was like, what? So what can you kind of repeat that?
Okay, so like we all remember COVID, right?
Yeah, yeah.
So like people were concerned like, when it got into your lungs and your oxygen decreased, a lot of people were getting intubated, right? From it
Correct.
from because their oxygen levels were dropping. So like they were saying like when you measure oxygen, if your oxygen got below 90, like start getting 89, 88, that's when you had to go to the emergency room and make sure you get your breathing monitored. And some of those people got worse, got intubated.
Correct.
Well, you think with sleep apnea, like they were telling you to go to emergency room below 90.
Correct. This is during COVID time.
Yes.
These were the protocols, because
Right.
immediately you had to go out there, and that way you could try to go in there and take care. Now, of course, we're not comparing, but I
Right.
guess
Yes.
I guess the point that you're saying is the
The
oxygen.
oxygen part,
Okay,
right?
yeah.
So imagine like you're sleeping every night, and I've seen these patients are getting into the 80s, 70s, 60s
What?
every single night because of sleep apnea. And you can
That's mind blowing, man.
imagine the damage it's doing, like that's doing to their organs, not having oxygen. You do it habitually every evening,
Every
and you start
night,
to
that's
deteriorate
what you go
fast.
through.
Yeah, so that's why the breathing part causes all these symptoms. You want to, this oral appliance will help you, and opens your airway so you can breathe better, or the other methodologies. But you have to breathe at night. I mean, dementia, Alzheimer's, all these, systemic issues, a lot of it is rooted from sleep apnea.
Because basically you're,
Or,
and that is the definition of
Mhm.
sleep apnea, as you were mentioning. I think we're also backstage, which is basically you're stopping oxygen going to your, in other words, you
Yes,
stop breathing.
yes. Hmm.
Wow, that is so wow. Honestly, that blew my mind when you were
Hmm.
like, yeah, and you were spitting all these facts. And I know that this show doesn't do due diligence, because the amount of time and everything that you were talking about, I mean, it's so much. But first and foremost, like I said, I really do want to go in there and thank you.
Thank you.
I
Yeah.
think that's so mind blowing. But back to the question that you were saying. So, what would be a message that you would like to go in there and kind of look at the camera, and then letting them know, like, hey guys, if you're seeking help, give me a shot. You could improve the livelihood of your life. The longevity, the quality will improve. What would you like to go out there and kind
I
of
think you
look?
said it perfectly. I'll just repeat what you said.
I know I should be working for you. It's because, you know what, I get so excited about the product, because it's changed me in these actual 2 to 3 months that I've been using it. I didn't look. I saw an immediate change about day 3 or 4. Because initially when you go in there and you put it on, of course, it's like wearing a mouthpiece.
Right.
So, having to go in there and get used to it wasn't hard. But the fact that I was waking up and I was like, hey man, I actually, like, I felt with energy. So of course I'm
Hmm.
gonna get excited. And why wouldn't we want to go out there and tell the audience, like, hey, I know that this might seem like pushing product or whatever it is, but I'm gonna tell you something. Like, here in this show, we like to go out there, we like to vet, we like to try things. And if it's not something that it's gonna help the people, then we're not gonna go out there and be like, oh, here you go. That's the last thing that we want. But if it could improve the quality of something, if it could save a marriage, if it
All
could go
right.
out there
Oh
and,
yeah,
you know what,
definitely.
if it could save a service member or a soldier, like, I just thinking like, hey, dude, I'm still mission ready. I still could go out there
Hmm.
and do. I don't want to leave my buddies. I don't want this to be the reason me not going on mission. Or a veteran, an individual that is like, hey, you know what? I want to take a right step to fixing, a lot of these actual chronic pain issues that I have. I don't want to be suffering. if we could affect at least one person,
Oh yeah.
I think that in itself is an amazing thing, So yeah, please, if you want to kind of go in there, look into the camera and let them know, like, hey, man, I think that would be amazing.
Okay. Oh, I was going to do one more
Yeah,
thing.
yeah, no, please.
Well, I mean, I always try to, when I speak to patients, like do analogies and stuff, so
Yeah.
they understand.
What analogy?
Well, think about this. Like, let's say, we're human beings. We're built. We have to eat. We have to breathe. And all that. So, if you can probably go about 40 plus days before you succumb to not eating, right?
Wow. Okay.
Okay, and maybe a week without water before you succumb.
Okay.
But you get brain death after 3 minutes of oxygen. So imagine these sleep apnea people are having episodes where they're holding their breath 30, 40, 50, 60, a minute and a half seconds.
Wow.
Every night when after 3 minutes of oxygen, your brain starts dying. Just think about it like that.
Crazy.
Yes. So that's why you get all those health issues. Like you're
I'm
not
so glad
dead,
you
but you're
said
causing
this. Yeah.
damage. Like, I mean, imagine like, okay, 3 minutes and your brain starts dying. These individuals holding their breath for a minute and a half. I mean, you didn't die, but something happened, right?
Yeah.
Yeah.
Wow.
Right.
Honestly, that you had never told me this when that's so true. Yeah, you could go so many days without eating. You could go so many days without, but your sleep.
Right.
Or you mean breathing is a completely different animal.
Mm-hmm.
That was mind blowing. No, honestly, I Dr. Connor, I believe that the mission that you have in front of you, what you've set your eyes on, I see it. I understand exactly what you're talking about. And you're a light in all of this darkness because there is a lot of misinformation in regards to sleep, in regards to how can I really go out there and better my quality of life, because the majority of us are bombarded all day through social media. Hey, 7 steps to better your life, 25 exercises that you must do, jump into this new diet, go in there and do this. But nobody, if you really pay attention, nobody's going in there and really pushing just quality sleep.
Right.
I guess it's because it's too simple, right? I mean,
because we all do it. I used to go, so maybe that's why. Yeah, I mean, I don't know, maybe because you're not in pain. Like, I don't, yeah.
No, but sweetie, is there anything else that you would like to leave the audience, or like to tell the audience?
Yes. So everything we discuss, if you're having, poor quality sleep, feeling groggy, want to improve your life but not being tired, your child is bedwetting late or ADHD problems, or you're on diabetic blood pressure medications, or you want to reduce your chances of cancer, or you're susceptible to Alzheimer's, dementia, any of that stuff, or you just want to, if you have a spouse that is loud so you can't sleep, so you're feeling groggy, I mean, please just come see me and I would love to help you out. I mean, I can be reached at 915-33-SLEEP. Thank you very much.
Dr. Connor, honestly, I really do appreciate you. Once again, I love the mission and what you've all set yourself to do, changing people's life through actually going out there and having, better sleep. Like your logo says, sweet dreams,
Sweet dreams, yes.
Yeah, I love it, to actually go out there. But what I love the most is, your passion for helping others and the fact that you have an interpersonal story on why you want to go out there. And like you said, really do appreciate you. I think that this is an amazing thing, and thank you for being on the show.
Thank you, David. Appreciate it.
Most definitely.
Appreciate you.
Thank you, brother. So once again, everybody, this is Sun City SITREP. One of the things that I want to let you know, make sure that you like, follow, and share. If you guys have any ideas, please comment below. If you guys have anybody else that you would love to go in there and listen to information, just like Dr. Connor and his company, Sweet Dreams, please go ahead and reach us out or, direct message us. I truly do appreciate you. This is your host, David Barraza. Until next time, signing out. This is Sun City SITREP. Thank you.
Tucking on
The
your
horn?
Yeah.
The klaxon?
Yeah.
What is it?